So I've been absolutely fascinated with the optimization of happiness for quite some time. And a number of years ago, I began to explore the design of many different aspects of my life to try to optimize for happiness. I experimented with my breathing, my diet, my movement, my material possessions, and the experience completely changed the way I think about happiness and its optimization. And previously, where I thought in many terms that it's sort of this higher order ethereal experience, I now found that there were many sort of evolutionary basics that played a really big role in my experience with happiness. And the experience was actually so profound that I started a company called Masamichi Sozo. And we work with organizations to optimize the happiness of their workforce and other individuals within the company, and also work with governments and others to optimize happiness of those that they support. And one of the big ideas has been that happiness is absolutely a complex issue, and there are a lot of different factors at play. But one of the really interesting opportunities is when we zoom out and begin to consider everything, we see neat opportunities and interesting opportunities for change. But the question I get most often is, well, that's great, but what's the one thing I can do to improve my happiness? And of all of those factors, I suggest usually that people should start with their sleep. So good sleep is a really important part of health, happiness, and well-being. And a lack of sleep or sleep debt correlates with heart disease, diabetes, obesity, depression, and even motor vehicle accidents. I mean, it's a really ugly thing. And in the United States, we have an absolute crisis of sleep debt. 34% of American adults report not getting enough sleep, and in some parts of the country, it's as high as 50%. And this has enormous implications for healthcare and for policy. And we became very interested in this problem. And so I want to share with you a project called Nightnight Everyone, where we tried to look at the complexity of the sleep issues in the United States and find if there was, by zooming out and considering everything, if there was a particular area that we could find an interesting intervention. And we kind of settled on the question of, would it be possible to actually improve world health by putting websites to sleep? So acknowledging that our phones and our computers, the apps we use and the websites we use do play a big role in the disruption of our sleep. And might it actually be possible to make some impact or change in this space? So Nightnight is actually just a single line of code. And anyone can take this code and drop it into your website and you're done. And within that code, there is a sleep time for the website and a wake time for the website. And once that code's embedded on the site, it allows it to run normally throughout the day. And so your website can optimize for profit, for growth, for conversion, for information, entertainment, any of the immediate goals that you have for that website. But as the user's device time starts to show that it's getting late, then Nightnight kicks in, it takes over, and it puts your website to sleep. So it's late. Nothing we can offer you is more important than your sleep. Sleep well, sweet dreams, and we'll catch you in the AM. So we're prompting sleep, but we're also trying to highlight this trade-off, the moment at which the value that's provided by the website is actually less than the value that your sleep could be providing you. And as soon as we launched the project, it was picked up by Product Hunt, a community of technologists and web developers and designers. And there were some really interesting conversations that began to emerge, and they were incredibly engaged. And while the project was trending on the site, we even had the founder of Product Hunt reach out and kind of weigh in. He called the project ridiculous and genius. And even went back to the Product Hunt community and asked, is this something that we should implement at Product Hunt? And so we've actually open sourced the code for Nightnight. So anyone in the world can download it and use it for free, can modify it as they would like for their website. We've had some really interesting requests for different features and functionality, and we've even seen it translated into some different languages. But the most interesting part of the project for me has been the reactions to it. And they've fallen into two categories, two camps. One group find it poetic, beautiful, human, and another group find it idiotic. They can't imagine, why you would limit the functionality of a website when actually they see this as wholly in the domain of the user, that this is their choice. And for me, Nightnight is really about this big idea of universal responsibility, that I have responsibility not just for the immediate goals and needs of the website that I've created, but I have a universal responsibility, an unlimited responsibility for the impacts and implications of that site in the world. And that includes the health, well-being, and happiness and sleep of the user that's come to that site. And when we think about the very, very complex issues that we're dealing with in healthcare, for me, I think some of the most interesting opportunities for change and impact will come as we begin to zoom out, consider everything, and then try to understand what universal responsibility begins to mean in these systems. And so I hope Nightnight is a sort of inspiration point for those types of conversations. And I absolutely believe that through considering everything and understanding universal responsibility, we'll start to see the type of change that we're dreaming of in healthcare. So thank you very much, and I hope everyone gets a very good night's sleep. So.